Scanogram of CT abdomen of a 72 years old female patient. Please observe angry looking small gut segments here. This one slightly dilated. Now I will show you her CT scan. This is the lung basal segments, atelectatic bands in the basal segments of right lower lobe along with the pleural thickening along posterior lower chest wall. She is a case of acute cholecystitis. Please observe gallbladder is distended. Its wall is not appreciable at places. Now this is the gallbladder. Patient is a known diabetic. Posteriorly its wall is not appreciable and there is a fluid collection lying posterior to the gallbladder. This is suggestive of a contained perforation of the gallbladder. This is not a pericholecystic abscess because if it was an abscess then this should have a wall around it which would have enhanced by the contrast medium. Now please observe that there are inflammatory changes in the adjacent wall of second part of the duodenum. Density of pericholecystic fat is increased along with the increased density of fat in right hypochondrium. Inflammatory changes are present in the hepatic wall of hepatic flexure of colon as well. So these are all the right anterior pararenal fascia is thickened. This one here. So these are the sequelae of acute cholecystitis and its contained perforation along with the inflammatory changes in the pericholecystic fat and fat in right hypochondrium and the inflammatory changes in the walls of the duodenum and the hepatic flexure of colon. Now in the scanogram I showed you the angry looking small intestine. Please observe that these are the, let me show you, this is the third part of the duodenum. Proximal jejunum is of normal caliber, but further low down jejunum and the ileum they are dilated, distended. No obstructing lane could be visualized. So there is a subacute small intestinal obstruction, maybe due to either adherence or the inflammatory stricture. Now this is the terminal ileum here. This is, its lumen is collapsed. This is the site of ileocecal junction, this one here. This is collapsed. So obstruction lies somewhere higher up. So this is a case of subacute small intestinal obstruction as well. The exact level and cause of obstruction could not be visualized. This is a small dermoid cyst in left ovary. Please see that the density is approximately -59 HU.